So palliative care has been defined as an approach that seeks to help patients with a life-limiting illness and their families, usually by sorting out their symptoms. So we focus on physical, psychological, spiritual, and social symptoms of the patient. So in short, what we do is to help patients and their families live with a life-limiting illness. In this unit, about 7 out of 10 patients that we see usually have cancer and advanced cancer. We also see patients who have organ failure, so liver failure, heart failure, kidney failure, and we see also elderly patients, and sometimes we see patients with dementia or Parkinson's. And also patients with chronic pain are referred to us because we also do management of chronic pain within the unit.
I've been a patient at Kenyatta since 2012. The type of cancer was neuroblastoma. I noticed it when it was so late because it's not painful. I went for 2 operations at the same hospital, Kenyatta. Both of the operations were safe. One was the hardest, but at least I made it out. Since 2012, I've had 2 operations. They've tried chemo too. I'd say it's been a long journey since 2012. That's when they noticed it.
Kila saa tulikuwa tunatibiwa, alafu tunarudi nyumbani, tunakaa jioni, tuko cashot. Mara mingi tulikuwa tunaenda cashot. Nilikuwa nashikwa na asubuhi na jioni, usiku tunakuja usiku. Sasa ile tulikuja huko cashot wakatuambia tukuje 28.
So James is a patient who was referred to us because of lower back pain. He came into the unit. He's been one of our longest patients. When he came to us, he was not walking. He had been brought in a wheelchair, we would have to be carried. And at the time of referral, pain was his most distressing symptom. So he was started on pain management with morphine and also a rehabilitative plan as he continued with his oncology treatment.
The pain has been easing, so it's kind of reducing, and it's been helpful to me and my family.
Akikuja kila saa siku hapa, siku alikuwa na pain sana. Alikuwa anatusaidia na kuko shidano analala, hivyo nasikia vizuri. Lakini kutoka siku ile tulikuja hapa 28 tumeona change ya blue. Nasikia vizuri na kopoa sasa. Sababu hiyo ngoja tu kukua nafikiria imefika hapo. Lakini sasa ile tulikuja hapa tukapiwa ako 4, tukajua kuko Mungu na anatenda na anaponya kila kitu. Sasa ile tunakuja hapa tumeona mabadiliko sana hapa, kwanza hapa 28.
The palliative care unit covers both the outpatient clinic and patients who have been admitted within the hospital. So we are located at clinic number 28, the consultant's offices. That is where the outpatient clinic is. So it's a referral specialized clinic. We open between 8 a.m. and 5. So typically when patients come, if it's a new patient to the unit, we open a file for them at 650 shillings, just like other specialized clinics. Then the patient gets an assessment, gets their prescription, gets their instructions. We give them a return date. If the patient comes back for a review clinic, we retrieve their records. They still pay 650 for review. So we are able to see them, discharge them home.
Sasa ile alikuwa hapa, hata daktari wako hapa alikuwa anaenda kumuona. Kwa kuwa anaenda na miguu, wanashukua na mweka kwa kitanda, tunamwacha hapo ndio kitu 5 days. Karudi nyumbani. Tulikuwa tunakuja hapa clinic.
The patients within the ward, a consult is sent to the unit. So when a consult is sent, we make sure that these patients are seen the same day the consult has come, before the end of the day. Because most consultations we get are for patients who have a distressing symptom. They could be in pain, they could be having difficulties coping with their diagnosis. So we see those patients, we discuss with the doctors within the ward, and we initiate them on the treatments that they need. Then we do have our specialized palliative care ward rounds twice a week. Tuesday we see children, and Thursday we see adults. So when they're discharged, we give them an appointment date for the clinic so that we are able to follow up on the management.
Sasa tukaambiwa aende physiotherapy na sasa yeye anatembea. Tumeona mkono ya bwana juu ya Kenyatta. Sasa 28 anatutibu vizuri, wanaongea vizuri, na rafiki yetu sana.
They have one of the best services because since I started coming last year, I've been seen by all the nurses and doctors. So I can just say they're all fair and good because they just take time and listen to you. Every one of them does that. They're nice and polite. They're helpful. They're so helpful.
If we are able to eliminate the symptom, we eliminate it. We do a lot of counseling for patients and families for them to accept their diagnosis so that they're able to go through their treatment and they're able to live positively with their illness. So we also give them social support. We've been doing support groups, but now we had to halt because of the COVID pandemic. But we've been having support groups where patients, caregivers, they come, they discuss their challenges and we try to brainstorm and see positive ways of coping with those challenges. And we help them to get discharged out of hospital as early as possible. Because sometimes when someone has an incurable illness, it is associated with prolonged hospital stay. So we help them to be discharged as soon as they can transition to home-based care. We link them up with the palliative care provider closest to them at home, and we educate them so that they know which situations are emergencies, when they should panic and rush to an outpatient setup, or situations that can be managed at home. We teach them how to manage them at home. So we reduce their hospital stay, we reduce their hospital visits, and overall we help them to cope with their illness.
I can do a lot of things. I wasn't playing basketball. I was off the court for some few months because of the pain. I was training and everything, but they're good with the pain management. They've taught me a lot of things. But yeah, I've improved. I'm playing basketball. I might try football next. I've been doing my normal activities since I started coming here.
Right now he's not using any pain medication. He's getting physiotherapy a few times in a week and his mobility has improved. So from James's story, actually we see what palliative care is all about. We do not tell patients to stop treatment, but they get palliative care alongside other active treatments that they're getting. So like for James, we've improved his quality of life. He's actually happy. His cancer is not cured, but he's living with it positively. His mobility is back. He's able to do things that make him happy, like play basketball, interact with his family. Even this morning he was asking me how to stop taking morphine because he feels his pain is now well controlled. He no longer needs the morphine.
I finished Form 4 last year. They helped me do that because I wouldn't sit like I'm sitting right now because of the back pains and everything. They've really been helpful. So I did my KC, SC, and yes, I passed.
Saila alienda theater siku ya kwanza ndio alikuwa anafanya 8 na akapita. Ya pili akafanya kilikuwa form 4. Sasa tunaambia Mungu ni asante. Na Kenyatta, Mungu awabariki sana.
And all you need to be is like positive about everything. It's never that easy. As long as I improve, nothing is impossible.
Kaza sio tia kumaliza. Kaza unaweza kugonjeka na upone. Vile amani yako imesimama. Na ile madawa unatumia vizuri na unaomba. Kwa sababu kila kitu daktari akifika mwisho kukomu, sasa tunaona mkono